Good morning, 1027 and 1035 WICY, your feel-good favorites from the 80s and more on a Wednesday morning, 9:40. It is Dr. Todd Whitman from Hyde Medical Center joining us in a series we've been doing here for a couple months now, really, Todd, ever since the coronavirus started hitting us heavier.
We have, and we appreciate being here.
Yeah, it's no problem. I just want to say, though, at least the North Country region, now that we have this laid out with the phases and everything, I think the North Country as a whole has done a very good job with the fight against COVID-19.
Boy, it's really amazing. The curve was flattened more than anybody ever thought possible, and it's all due to the efforts of the community and their willingness to isolate and wash hands and do all the things we've talked about in previous weeks.
It is, and in order to get to phase one, which we had to do, was to get some more testing in there, and testing's a huge thing. Antibody serologic testing, significant concerns, about the test make it difficult to know whether or not it's effective or efficient as far as the use of our resources. Todd Whitman, explain on that a little bit more for us.
Absolutely. So I'll just start by giving you a brief introduction to what antibody testing is. So antibody testing is not looking for an acute infection like all the testing we've talked about previously, but instead it looks for infection-fighting proteins in your blood called antibodies, which were developed due to a previous infection. And so if you were infected a few weeks ago, you might develop antibodies that may be identifiable now. The reason there's so much interest in this is because potentially people who have a positive antibody test could be immune to further infection with COVID-19. I say could be because we really don't know yet whether a positive antibody test confers definitive immunity. This has been a real problem for us, John, because everybody in the community wants this testing, mostly because politicians and the media got way out in front of the science on this one. They made everybody think this was going to be the holy grail. And in reality, we don't even have an FDA-approved test yet. There are tests out there that we can use, but we do not know the characteristics of those tests and whether or not it's the right thing to do. There's a lot of danger around false positives with these tests. And, a false positive might mean that somebody thinks they're immune to COVID-19 when they're really not. And if we were to do the test on an asymptomatic person here in the North Country right now, it's really 50-50 whether they would have a true positive or a false positive. So
Okay.
Real problem there. And we as a health network, the UVM Health Network, have decided that other than in specific circumstances, which I can fill you in on later, we're not going to offer this test to people. When the test improves and we have the right test to offer, we will certainly get it out there. But for now, we think there's a potential for more harm than good with this testing.
I think that's a smart move to make, at least for right now. I know when it comes to stuff like this, we need more things concrete and to be sure about it. So we are sure right now that we're starting to reopen at least certain essential businesses. And, are you guys excited to welcome folks back? And what do you want to tell them about the community and what you guys are working on over there?
Boy, we're really excited. Things have opened up nicely. We now at Hyde have increased elective procedures, and people are getting all the things done that they've been waiting on for so long. We think we've developed really safe plans across the UVM Health Network, specifically at Hyde, to make sure that we can get people in safely. So, a lot of patients we call are concerned, but then when we tell them about all the measures we're taking to make sure they have a safe visit, people are more comfortable, and after their visit, they're usually thrilled. So we're really moving in the right direction and happy with how things are going.
All right. It's Dr. Todd Whitman with us from Hyde Medical Center. Todd, and where else are you affiliated with?
I work at CVPH Medical Center and at Hyde.
CVPH as well. We always have to get that in there. Again, until next week with great updates on things, I think we're moving towards the right direction. And thank you so much for being on the line with us this morning, okay?
Hey, thanks so much, John. We look forward to talking to you next time.
All right. It's Inside Community here on a Wednesday morning, 1027 and 1035 WICY.